Shall we start? Good evening, everyone. Namaskar. Welcome to the.
Sorry, 1 second. It's showing recording paused.
No, to me it is showing recording.
Okay. My screen is still showing paused. So as long as you know it's being recorded.
Okay. You can record on your computer also.
Okay, recording is on. Good. It's showing me still paused. Maybe because initially I was host and
Yes.
sorry about that. Go ahead.
No worries in that. Okay. Good evening, everybody, once again. So on behalf of Council for Ayurveda Research, I am Vaidya Meenakshi Gupta, one of the board of director and chair for Council for Ayurveda Research Journal Club as well. So we welcome you all. A little bit about Council for Ayurveda Research. CAR is a pioneering initiative to promote and establish Ayurveda as an evidence-based health science globally. One of our core goals is to create a platform for the exchange, interaction, and integration of information, competencies, expertise, and resources between apex academic institutions. Our long-term goal is to become the Nobel Agency for Indo-US collaborations and initiative for research in Ayurveda, with the ultimate aim of establishing Ayurveda globally as a credible healing science. And I would like to invite everybody to join the CAR as a member so that they can support our mission and we can grow globally Council for Ayurveda Research on a bigger platform. So right now for Council for Ayurveda Research, our founder is also with us, Dr. Pratibha. And with this, I would like to welcome you all once again for the Journal Club meeting today. And today's our speaker is Vaidya Archana. And she's going to present the paper for the critical analysis. Dr. Archana, you can start.
Good evening, everyone. This is Archana. Today, I'm going to present a research article. Let me start. So the title for today's presentation is an Ayurvedic personalized prophylactic protocol in COVID-19. The author is Pratibha B. Nair, Parvati G. Nair, Pratap Shankar K. This journal has been published in Journal of Ayurveda and Integrative Medicine in the year 2020. So I'll start presenting this. Do I need to read the disclaimer too? Yes. So this presentation is meant for educational purpose only. None of the information is presentation meant to replace a medical advice. The information presented in the slide is not verified or approved by FDA or any such agency. The presenter makes no claim, promise, or guarantee of any kind regarding the information presented here, expressly disclaims liability of any kind. So as we all know, this COVID-19 pandemic brought about by SARS-CoV-2, a novel coronavirus, is creating intense health havoc globally. There are so many researches being done to identify the cause and to basically find out the pathogenesis so that they can find the cure. But still, till now, nothing has been established and nothing has been clinically proved, which can be a confirmed treatment for COVID-19. So author here proposes a hypothetical model. He put forward the hypothetical model of Prakruti, which is an Ayurvedic body phenotypic character based personalized prophylactic therapeutic strategies aiming at better immunomodulation and a quicker resolution of host immune mechanism. As we all know that in this COVID scenario, the most important thing is everybody is like trying to impose or trying to tell everyone that immunity has to be made stronger so that it can fight the battle of the person suffering with COVID-19. So immune mechanism is highly individualistic, being that in Ayurveda, there is a concept called as Prakruti. So as we all know that this COVID-19 virus doesn't hit everybody at the same extreme or with that same, I would say, mortality. It differs with individual. So this difference is basically because of the Prakriti or the body type one holds. The author also suggests a community-based, a level personalized Ayurvedic protocol and active therapeutic strategies based on DOTS model. So as we all know, the DOTS model has previously been used for the tuberculosis, wherein the patient comes and directly the patient is given the medicine so that the I would say the compliance is improved, because sometimes the patient doesn't take the medicine and we don't know how effective or how efficient the treatment mode is. So thereby the author also suggests that we should, like he's trying to say that this protocol should be applied on the basis of the DOTS model, which is directly observed treatment system. I would give a small background of since everybody knows what coronavirus is, but still I would like to mention that this is the severe acute respiratory syndrome coronavirus 2. This is called as SARS-CoV-2, a novel beta coronavirus, which is responsible for the pandemic pneumonia of 2020. The family of COVID-19s lately have been the pathogens of emerging respiratory disease outbreaks in humans. Scientists from various global health organizations are desperately putting efforts into research on SARS-CoV-2 pathogenic mechanism for developing prophylactic therapeutic measures that would contain the transmission of this highly contagious virus and effectively reduce the number of casualties. As we all know, this is all because of derangement of post-immune homeostasis. So therefore, the author has specifically stressing upon the fact that if the homeostasis or the immune system of the host is better, then they can fight the battle of the COVID-19. Immune homeostasis, as I mentioned, is distinctive to individuals. Factors such as genes, gender, nutrient status, age, gut flora, dietary habits, physical activity, alcoholism, and other substance, pregnancy, etc., highly determine the cross-sectional immune status of the individual. So if we can predict the extent of what the immune status is, we can ideally, by adopting the personalized prophylactic treatment, we can counteract the side effects or the complications which this virus is giving, and we can create a better environment inside the human's body to fight the battle so that they can recover fast. So the hypothetical model, it intends to discuss the significance of Prakruti assessment in screening or predicting those who fall into deteriorating states if afflicted with COVID-19 infections. So here the author has proposed a hypothetical model. So the author is trying to correlate the symptoms as like the Ayurvedic treatment which we use in certain conditions with COVID-19 symptoms. So it has not been yet, brought into the practice, but the relation he has done is like, I would give a brief overview that how he has correlated or linked that COVID-19 symptomology with Jwara principle. Jwara, as we know, is fevers. Is in Ayurveda, fever is called as Jwara, is of varied origin, and it has been mentioned in detailed texts of Ayurveda, like in Chark Samhita, in Sushruta Samhita, and Ashtanga Hridaya. So understanding this Jwara symptomology is important in assessing any disease progression and severity with respect to clinical and biochemical host response. So one of the main factor which author has been trying to emphasize was that he mentioned about the sickness behavior. So what is that sickness behavior? The sickness behavior, it refers to behavioral immune system, which is behavioral, cognitive, and emotional symptoms that go along with infection, such as fatigue, loss of appetite, and social interest, which we are noticing in the COVID-19 patients also. These sickness features of behavioral immune responses are detailed as prodromal phase, which is Jwara Poorvaroopa stage in Ayurveda. As it is said that earlier the diagnosis, better the treatment, and better the condition of the patient. So if the Jwara Poorvaroopa state diagnosis is done, the prophylactic therapeutic measures which are taken in the Poorvaroopa state it gives a better result in the improvement or better prognosis in the COVID-19 patients. In the patients who are suffering from Jwara. In the same way, the author is trying to link that these Jwara Poorvaroopa symptoms are kind of similar, and they have done the comparison with the COVID-19 symptoms. I can show, yeah. As we know that in COVID-19 patients also, the patients suffer from fatigue, they suffer from bad taste, they suffer from watering of the eyes, they suffer from rapidly changing linkage of rapid mood swings, body aches, feeling of heaviness, anorexia, chills, feeling of heaviness in body parts, aversion to good services. There are these symptoms, they have been linked and they have been found in Jwara Poorvaroopa. So they are trying to link these symptoms, and they are trying to hypothesize a model that if in a patient, if we can identify the prodromal state, if we can identify the Poorvaroopa, we can give a better compliance, and the treatment can be done at an earlier stage and the patient can recover fast. So before I'll talk about this. I'm not going in detail with the types of Jwara. It is mentioned in the paper and we can read that. But the most important part is like immune mechanism and Prakruti. Disease susceptibility and selection of prophylactic and therapeutic measures as per Ayurveda significantly depends upon Prakruti. Immune mechanism, that is the bala, are determined by Prakruti of individuals. So the author has also said that there have been various studies and various cited research have been done where it has been found that the Pitta predominant individuals exhibit elevated innate immune responses and hypersensitivity. Kapha predominant Prakriti individuals, there are higher expressions of CD25 markers and CD56 exhibiting stable immune responses. Compared to all these Prakriti, Vata predominant Prakriti individual showed compromised or low potential immune responses. Further, there have been another study on genome expression and biochemical correlation of Prakriti. It also stated that the Vata Prakriti individual exhibited a distinct down regulation of genes involved in response to biotic stimulus and inflammatory response. So with this, it has said that Pitta predominant Prakriti individual, they demonstrate overexpression of genes related to immune response based on more pathogen recognition receptors, more inflammation and hypersensitivity. Whereas in Kapha Prakriti individuals, it presented with overall upregulation of genes involved in cellular biosynthesis and purine salvage pathway, where it says that in that Kapha Prakriti individual, there has been a balance, and Kapha Prakriti individual, they have intense immune response symptoms that at times may result, whereas in comparison to Pitta, which is where in Pitta individuals, there is a higher reaction to that immune responses, hypersensitivity and inflammatory responses are there, and more as compared to Vata and Kapha Prakriti. So this, they have been trying to go back. And then this chart is being shown that if we identify the prodromal phase, if there has been an infection based on Prakriti Ansara and specificity in Dosha vitiation, if we see the manifestation of Poorvaroopa has been identified, it is easier to treat the case as compared to when it passes to its main stage of disease, where it manifests as Jwara, the adaptive immune responses. So in different individuals, it has been shown that in Vata dominant, there has been down-regulated immune mechanism and lower immune response, which give rise to Vata-Pradha, Visham Jwara, which is also called as Chaturthak Jwara. In Pitta dominant, there has been an intense immune response, exaggerated inflammation, which results in arm-wish, and it is called as Samasannipata Jwara, wherein all the three doshas are involved. In Kapha predominant, since it is a stable Prakriti as compared to the researchers cited, they have better synergistic stable immune response. And if they're not properly managed, it can also lead to Kapha Pradhan Jwara. So the main idea the author is just trying to present is that if we try to catch the symptoms at this stage, if we try to identify this stage, we can avoid this complicated stage wherein the disease manifests in its full form. So if this can be controlled, this can be avoided, and it is easier to treat because there are less complications. So now, since we're talking more about Pitta Dosha, so we'll talk about Pitta Dosha Ama inflammation driven damaging phase of immune response. As we all know that Pitta Dosha among all the three doshas is casually linked with inflammation and immune mechanism. Notably, it is also responsible for digestion, metabolism, thermoregulation, and energy homeostasis. And if it is not in control, it gives symptoms of Jwara as well. Pitta dosh manifests as Agni. As we all know that Agni is appropriately translated in a study as a primary entity responsible for the metabolic and transformative process at physiological and cellular levels. If there is improper digestion, or if the Pitta is not in a balanced phase, it can lead to Ama. Ama or Ama dosha refers to a substance formed as a result of improper metabolism at varied physiological levels, and it is non-homogeneous to bodily tissues. Since it is non-homogeneous, it can also serve as a candidate causative agent for Jwara. It is not surprising that it is inferred that recognition of Ama by host cells it can act as a non-self which triggers host immune responses. So I would elaborate this statement that Ama thus may also be inferred as excess accumulation of endotoxin and other inflammatory mediators. So Pitta dosha predominant Prakruti refers to an increased physiological activation of Pitta dosh as compared to Vata and Kapha at varied levels. Evidences and researches and studies have been done which have proven that Pitta dosh individuals, they exhibit more inflammatory responses, and the disease, the form of disease in those individuals is more complicated or in a more worse state as compared to Vata and Kapha individuals. So now they have, so this is like basically they are relating. So before that, they're trying to give the background of the diseases they have treated and how they can correlate with COVID-19 disease and COVID-19 symptoms. So usually like for Pitta disorders, Virechana is the treatment. As we all know that, I think I've lost the slide. Yes. So Virechana refers to a therapeutic purgation, which is indicated in Pitta dosha related disorders. Virechana is also indicated in Jwara, Amdosh, and respiratory ailments like SWAS, as asthmatic conditions, in chronic cough, which we can consider the pathogenesis and site specificity of COVID-19 affliction. They are here trying to relate that as in Pitta disorders, like in Jwara, there are symptoms which are the symptoms similar to found in the COVID-19 patients, and in Jwara, wherein the treatment mode is like Virechana. So for the people who suffer with COVID-19 virus, they can consider Virechana as a mode of treatment for the improvement. The effectiveness of Virechana, they are now trying to explain that Virechana has been effective in Amavad, which is rheumatoid arthritis, and Vichurchika, which is atopic dermatitis, and it is evident that there is involvement of deregulated immune homeostasis. So therefore, they're trying to say that in these disordered diseases like RA and atopic dermatitis, there is deregulated immune responses, and in these diseases, Virechana has been done, and the patient has been cured with the Virechana and other treatment modalities. So anti-inflammatory effects of Virechana is also reported. There have been cited studies, and it has been mentioned in the paper also. So here the author is trying to propose periodic person-centered Virechana, starting from the Poorvaroopa state itself, where the earlier symptoms are identified, as you mentioned in Jwara Poorvaroopa. As a prophylactic measure in diagnosed cases of COVID-19, with mild to moderate symptoms as well as high to low risk primary contact cases with an infected individuals and essentially who have Pitta predominant Prakriti. So they have tried to limit the number of patients, or they have tried to limitize that this treatment modality can be performed in who have been with who are suffering with mild to moderate symptoms of COVID-19 or who have been in contact with primary contact positive case. So they are not trying to say that a patient who is critically ill or who is in ICU, we should perform those activities to them. These modalities or this model is basically for prevention, as Ayurveda has always been for, that prevention is better than cure. So they are also hypothesizing is the fact is that relating different types of diseases and their treatment in the fact that in COVID-19 patients, these symptoms have been found as they have been found in Jwara, Poorvaroopa. So they have linked together. And since those treatments like Virechana, Basti and other treatments have been effective and treated the patients suffering from those Jwara, rheumatoid arthritis, etc., they might act as a mode of treating patients in COVID-19 because till now nothing has been yet identified as a drug of choice or basically a management for COVID-19 patients. So here they're trying to link, since it has been effective in these diseases, it might be effective in COVID-19 patients, but they have limited the role in that they should be suffering from mild to moderate, or they must have been in contact with primary contact and who has been quarantined. So since we have talked about Pitta Prakriti, but there are different types of Prakritis also. There are 3 types of Prakriti: Vata Prakriti, Pitta Prakriti, and Kapha Prakriti. So in Vata Prakriti predominant individuals, as we all know, that they are of Alpa Bal, but it is like there are different 3 types of Bal: Alpa, Pravar, and Madhyam. So the Alpa is like they have very less strength. I would say that they are more if a scale of 1 to 10, they would be towards like 1 or 2, 3, 4. And Kapha Prakriti, they have Pravar, like with a scale of 1 to 10, they would rate themselves as on the scale of 10. Pitta, they might differ. It can be like 7 to 8, 7, 8, 9, 10. So accordingly, the above cited studies on immune mechanism and Prakriti concluded reduced or compromised immune responses in Vata Prakriti individuals, making them more prone to infections. But since the inflammatory responses and hypersensitivity is less as compared to Pitta individuals, so the complications or the severity of the disease is less in Vata predominant individuals, which they have hypothesized. They also hypothesize that although Vata Prakriti individual may be prone to infections of varied origin, including the current viral outbreak, they may not enter into severe deteriorating stages of tissue damage caused by the immune responses. This is because, as we have seen in the previous slides, and there have been researches done, that Pitta predominant individuals, they exhibit more kind of inflammatory responses and more kind of immune mechanism, and I would say not immune mechanism, I would say they have more susceptibility, or they're more prone to get infected to those inflammatory diseases, inflammatory responses. Now, in short, I would say that there is comparatively lesser chance that the inflammation-driven destructive phase of immune response be triggered in an infected COVID-19 case who is a Vata predominant Prakriti. But as we all know, the respiratory functions are highly influenced by Vata dosha. Pranavayu, which is the seat of Pranavayu in the lungs. We need Pranavayu for our breathing. So it is a vital force which is the seat of it is in the lungs. So thereby, like, the respiratory functions are also highly influenced by Vata dosha. So they have said that the Virechana can also be considered as a mode of treatment, mild Virechana to Mridu Virechana in case of Vata Prakriti individuals. The ideal treatment for Vata individuals is Basti. Basti is therapeutic enema, which is specifically indicated in Vata disorders or Vata dosh aggravated states. The medicaments in Basti are expected to reach the proximal colon. As we all know nowadays, like everybody is specifying on gut health. So it is called as a second brain. So the gut is the abode of diverse microbiome. The gut microbiota consists of complex organisms that significantly influence host immune homeostasis. So here the author is trying to say that since Basti, when it is given, it reaches proximal colon. So it also it covers the gut area. The gut microbiome, they displays Prakruti specific differentiation in microbial colonies. Therefore, it is not surprising that there are precise types of Basti indicated in specific disease condition. For instance, they have come to the diseases where the Basti has been effective in treating Vata disorders, like Tikta Shira Basti is indicated Asthi Majjagata Vata. So this Asthi Majjagata Vata is disorders of bone and bone marrow origin. As we all know that the role of bone marrow in host immune mechanism is fundamental. And it has been said that Vishama Jwara, namely Chaturthak Jwara. I haven't gone on the slide, but you can see in the paper that the Chaturthak Jwara, which resembles the features of COVID-19 significantly, manifest as a result of doshas at the level of bony tissues and bone marrow. There have been studies which the author has linked that in cases of ankylosing spondylitis, which is a type of Asthi Majjagat Vata, wherein host immune homeostasis is altered, and one of the treatment modality adopted was Basti. So they are trying to say that since it has treated in that case of ankylosing spondylitis, and the symptoms are similar to COVID-19 of the Chaturthak Jwara symptoms are similar to the symptoms of COVID-19. So this can be adopted as a treatment modality wherein this type of Basti can be given to those patients who are Vata predominant individuals and have and exhibit symptoms similar to Chaturthak Jwara. Erand Mooladi Yapan Basti, another type of Basti, explained in the context of healthy longevity, is commonly administered in Vata cough disorders. So they have also hypothetically linked between Vata dosh and immunomodulation. It suggests that the utilization of Basti in immunocompromised Vata predominant Prakriti individuals, or as a matter of fact, in any individual, is a resolving phase of immune responses in order to bring back immune homeostasis. So they are saying that there have been scientific leads and there have been diseases wherein the Virechana and Basti has effectively improved the condition of the patient. So why not we can try this type of treatment modality since the symptoms are similar as in COVID-19 patients, varying with different different symptoms and different disorders. So why not this treatment modalities be tried in patients with COVID-19? Since they have given a proven and a desired results in the patients suffering from the diseases wherein the Bastis have been effective and they have managed the case. Hence, here they propose a person-centered prophylactic Basti therapy with all precautionary measures, with like all hygiene and in Vata predominant Prakriti individual, either diagnosed with COVID-19 or those who are quarantined for a high to low risk primary contact with a positive case. As we all know that Basti treatment in individuals of any Prakriti while in resolving phases of immune responses triggered by COVID-19 infection to initiate a quicker immunomodulation for bringing about immune homeostasis. This has been immune system has been in the researches, in the talks everywhere, that we have to build up or we have to strengthen the immune system to fight. And this can be used as a preventative measure. So this can be used as a treatment mode where the patient thinks he might have been in contact with COVID-19 patients or who has mild to moderate symptoms. So Thereby, this is a treatment modality they have proposed. Now they say that Rasayana therapy is used for the rejuvenation and indicated as after Soshodhan therapy. So after this Virechana, Basti, these are all Panchakarma procedures. So after when this procedure has been done, Rasayana is a given. As we all know that Rasayana is very important as it is an immunomodulator. So everybody's talking about immune system means nobody's talking about like what it does and how it helps. Okay. So this Rasayana gives immunomodulating and tissue homeostatic effects. There have been scientific leads which proposes use of ashwagandha as a single drug in immune homeostasis, especially in COVID-19 cases. There have been no as such clinical research studies or proven data, but yes, there have been cases wherein patients using this ashwagandha, they have got treated. I mean, the immune system has gone stabilized or immune system gets better. So the author is trying to, this is the author Ayurvedic personalized prophylactic protocol, wherein they are trying to tell like in different Prakriti and different individuals how we can start the treatment. This is a phase 1 where the author is trying that if we can capture or if we can identify the symptoms and treat in this phase, we can prevent these stages. But if somehow we are not able to treat this phase or we are not able to identify, so they have also described this treatment which can be done in phase 2 and phase 3 phase. So they can be like, I'm not going in detail because there are Panchakarma procedures, but this is like I just mentioned about Pitta Shira Basti, and this Aran Muladi Basti. This is Vata predominant Prakriti, Pitta and Kapha predominant Prakriti. So how they have bridged or how they have tried to link with different disorders and different diseases and COVID-19 symptoms or COVID-19 management strategies. So they are saying that based on the above discussion, they propose a person-centered prophylactic therapeutic strategy based on Prakriti. They have highly emphasized on Prakriti assessment because if the Prakriti of an individual is assessed, it is easier to differentiate or it is easier to categorize the treatment mode, or it is easier because as we all know that Pitta exhibit higher inflammatory responses as compared to Vata and Kapha individual. Thus, the complication of disease is more as compared to Vata and Kapha individuals. They have also intended and they have also emphasized for effective for the host immune homeostasis. And therefore, they say that they have categorized into 2 parts by prophylactic therapeutic internal medications and COVID-19 protocol, where they have linked with other disorders. They are saying that after the case has been identified, instead of giving a single drug, polyherbal formulations should be given, as these are stable compounds and are therefore safer and more effective when compared to single herbs or herbal extract, especially when there is a tissue homeostatic crisis, as in COVID-19. Then they propose person-centered prophylactic therapeutic protocol for enhancing host immune responses in COVID-19 patients, like Virechana, and then Basti, and then Rasayana therapy. So now this is what their protocol DOTS model, they have kind of categorized, and they have kind of made in tabular form that this is a pilot model where they say that if we can identify district level containment zones, and then they can collaborate with different health centers, they can do a household survey with collection of data, Prakriti assessment at household with structured questionnaires, and then they can distribute the prophylactic kit, and they can monitor an evaluating system, which is like the DOTS model. You see in front of the patient and you give the patient the medicine, and he or she has to take in front of you. So the same way they're trying to make a model wherein they are doing Prakriti assessment and they are giving the prophylactic kit, and then they are issuing the card, and That's what their model is. So what outcome measure they are saying that the home what they see is I'm sorry, that host immune responses are very much distinctive and thus personalized prophylactic or therapeutic measures are decisive to sustain in a highly contagious outbreak such as COVID-19. Therefore, the protocol proposed by the author with the objective of imparting better personalized host immune responses. They have categorized the outcome measure into two parts: host immune homeostasis and inflammatory levels after intervention, and host immune functional homeostasis after intervention. So this is like the hypothetical model. They have put forward a novel person-centered approach, which may positively induce a better host immune homeostasis by reducing the chances of untoward events of aggravated immune responsiveness and subsequent inflammation-driven tissue destruction, which are candidate causes of COVID-19 related casualties. So this is what the author has presented its model, the hypothetical model. And I am not here to criticize, but I feel that at this pandemic level or at this level where there is a huge havoc, it is difficult to do Prakruti assessment. And I don't know how honest or how effective will it be while distributing the prophylactic kit, because the main is the compliance. This is what I think, and they have categorized into vata and pitta and kapha, differentiated and emphasized on immunity, which is good because the immune system and homeostasis to maintain for that COVID-19 treatment is important. So this is what I feel, and I would like to have other opinions too.
Would you like to stop sharing, Dr. Archana? Thank you. All right.
Thank you so much, Dr. Yeah. Wonderful presentation.
Yes. Very nice presentation. I mean, I would love to definitely share my thoughts, but let's open it up to, there are 3 more people on the call. Would you like to comment, share your thoughts? Dr. Mahadevan, I think Ashwini, Suniti.
Can you give me a few minutes? I just got a call from someone.
Okay,
I'll be
okay,
right.
Sure, definitely. The rest of the people, everybody can open their mic and camera also so that we can do the discussion.
Yes. Feel free. There's nothing like, there's no wrong or right here. But in any case, in meanwhile, I'm happy to like start sharing. So thank you, Dr. Archana. Good presentation and good summary of a very elaborate paper. My thoughts were that there are some good aspects of the paper. Definitely, they have kind of initiated an effort in trying to, formulate some kind of correlation between classical Ayurvedic Jwara approach and what we are seeing in COVID-19. But I think there are parts of their expectations and their recommendations that are probably some parts can be taken as possible implementations in the healthcare system, in public health system, but quite ambitious, I would say. And I don't know how much feasible. And I think principle wise also, I felt there were some gaps because there is an effort to kind of map the different types of Jwaras with the different types of COVID-19 clinical presentation. I think what is important to keep in mind is that this was published in August 2020, which means it was submitted a few months ago, probably. And at that time, the main presentation of COVID-19 was ARDS, right? And it was more focused on all this Pranavaha Srotas here. So after that, we are seeing, and at that time, the age groups were different, the older and the very young and immunocompromised, etc. So I think from just even there are, I felt personally that there are many gaps in the paper, and this is the reason, this is the purpose of Journal Club, is to critically discuss the paper. So it's a little bit maybe a difficult part, but we have to do it because it's helpful for us to identify how we can do better in future upcoming efforts like this. So I felt that conceptually, like from Ayurvedic principle perspective also, all of the Bastis, for example, that are being recommended, on one hand, we are recognizing that diarrhea, nausea, those are the symptoms. Then how Basti can be a treatment of choice. And risk age group is older. So Bala Kshaya is there and very young. So how can we give, except of Matra Basti, I can't think of anything else that can be safely given.
But
So
Dr. Pratibha, but they have also mentioned that they are trying to limit that treatment more for the patients who have mild to moderate symptoms and who are not those who are not severely affected.
but still,
I'm not. Yeah, you're right.
I feel even if it's like mild to moderate diarrhea, can we
Yeah.
give Basti in
No,
that?
no. Yeah, you're right.
That's the main question. I mean, we are going to put them from moderate to severe in that case.
Yes.
The
And
Virechana also is kind of like in those on the similar parameters. Virechana and Basti both we
yeah, both cannot be given.
Yeah.
So, and then the thing is that, uh, what was I going to say? That, yeah, on, so it's, see, I'm a classically trained Ayurvedic Vaidya, and I also have my MPH. So I always see this, kind of, difference of approach or limitations between the individualized and personalized approach of Ayurveda, and how challenging it can be to offer that approach on a population basis. So this is a classic example of a paper that is trying to do both. So it's a very a very concerted effort to try and bring the personalized approach on a population based offering, and that is always problematic because you can have a very generic and broad skeleton of framework for applying, but when you start getting specific like this, that Vat Pradhan and Pitta Pradhan, and this will be the treatment of choice, and this will be the phases, mild to moderate, and this that, or in the beginning prophylaxis, etc. We are talking about trouble here because first of all, Prakruti analysis is so subjective, because if there is error there, everything else goes into error. And that's one problem. And the second is what they are recommending is fundamentally flawed. That is problematic. So I think there are some good things to glean out of this paper. Like, I really like the idea of maybe for future pandemics to create a database of Prakrutis. And Prakrutis don't change. So if we can get local experts to go in and start creating that database, centralized database, for not just pandemics, it can be helpful for so many other public health, offerings, preventative as well as therapeutic. So just in a nutshell, I want to give the chance to everybody to comment. So Dr. Mahadevan, would you like to comment something on this?
No, I am not an Ayurveda person. So I am still in the learning stages. So please, I will listen in on what you all have to say.
Dr. Meenakshi, you want to say something?
Yeah, the same, the Basti treatment and the Virechana, which we already discussed, and regarding the Prakriti also, the same parameters we cannot build, as long as, I mean, there is always an chances of error when we talk about the Prakriti. And also I felt the Mansik Prakriti also, they haven't touched based on that. It was just based upon the physical Prakriti. And when we talk about Prakriti Vikruti also, we definitely need to determine here, which was also kind of like a little mess here. So yeah, yeah.
Yeah. And sorry, I lost my train of thought, but yeah, a lot of such fundamental errors are there because they are proposing the Prakriti based thing, but here first of all it is a kind of a acute case scenario. For prophylactic, this has to be, it's a huge project to get into that public health offering of the central government, their whole ASHA and all of that, those vehicles they have, the public health worker, social worker, and all. Because every household, it's almost like doing the census. Every household has to be mapped that way. So that's a huge undertaking. So we can take some core good things which this paper is proposing, but their main proposing point, I feel, is quite flawed. Yeah. So, like, it's going to fall flat on its face because people don't present in ideal case scenarios that we write in our rooms, in an academic paper. We haven't considered comorbidities here. We haven't considered age groups here, which really changes your recommendations drastically, right? So, yeah, even with the things they are recommending, the case scenarios, there are contradictions. The Chaturthak Jwara, diarrhea and nausea you're mentioning, and you're saying Basti.
Basti.
And moreover, it is based on only the pranvaya srotas, which is, we all know that those parameters don't fit even from the beginning also, though it started with the lungs involvement. But then also that time also, when they in July or August, right, last year, by the time it was there, we already knew that it is affecting more than the lungs and the pranvaya srotas. All the srotas are involved in this. So that was also a kind of like little bummer there. But yes, there are some good points which we can take, and there are some points which are not goes very well with the presentation when we want to do on the research parameters.
Yeah. Some of the charts are interesting, some of the tables are interesting, but it's again, if you really look critically, it's like a forceful effort to correlate something to totally different things. And that's why it does not serve the purpose of the people, which is to try and get to kind of a standardized approach, which I think always goes contradictory to Ayurvedic approach. When you try to standardize something too much, it kind of is not aligned with Ayurveda, which is really one person, a personalized approach as per each individual's unique blueprint, etc., and unique presentation. So it's always that thing comes. So I think this is an effort to follow the modern framework. Very, very desperate effort, I would say, but it has not come out as one would hope. Yeah, they don't correlate, first of all, as much as we would like to. Those charts are good, they're very interesting, but I think because the primary hypothesis is kind of starting on a back foot or flawed setting, so everything else therefore has become flawed. Thank you. But so we are at the end, are we? Yeah, 8 more minutes.
Yeah. I mean, from this paper, I would just say that as a preventative measure, I should start using or Rasayana so that I don't fall into that COVID thing. So that is what I feel, that, like, be like healthy individuals, like we can have those like Guruji and other stuffs.